Hello everybody, welcome to Dr. Chan's Medical Ailments Forum today. So the topic that I'm going to talk about right now is hay fever and how to manage it. The reason that I chose this topic is because this few years I've been suffering really badly from hay fever. So I feel for the people who actually have this condition. So I thought I'll just, spend a few minutes talking about what is hay fever and how to manage it and what are the symptoms. So hay fever actually means seasonal allergic rhinitis. As the name suggests, it normally comes on in different seasons, so different people might be slightly different. Allergic rhinitis means inflammation of the nasal mucosa that's secondary to allergies. Most of the time, hay fever is triggered by pollens, and pollens are basically a kind of proteins that are produced by plants or flowers during the reproductive cycle. And these proteins can potentially irritate our nasal mucosa or our eye lining to kind of cause irritation, and irritation causes inflammation and discharge. So quite a lot of times people will complain or I suffer really bad from hay fever, mainly with itchy eyes, runny nose, and sometimes with a cough. The cough comes from the fact that your nose lining is really irritated and it's starting to secrete some sort of discharge. Most of the time it's clear in color, but they don't always come out from the front of your nose. You can't always blow it out. So what happens is, especially during the night when you're sleeping, these discharges tend to kind of trickle down to the back of your throat and causing irritation. So for me, the hay fever symptoms for me are not itchy eyes or runny nose. It's actually a really dry, tickly cough that I couldn't get rid of. And also sometimes it can cause earache as well, because obviously it can affect the eustachian tube, which is the tube that's connecting your ear, nose and throat. And if this tube is being blocked or inflamed, it can't balance the pressure from the outside of your ear to the inside of your ear, so it causes a pain because of a change of the pressure. So these are the general symptoms of hay fever, but sometimes some people get nosebleed from it as well because of the irritation of the lining. So some people might say, well, do you only get hay fever in the summertime? That's not always true. Depends on what you're allergic to. Now there's several different kind of pollens that we need to be aware. It's easier to kind of divide them into three different types. So that's of a tree pollens. You can be allergic to grass pollens and also to weeds. But it's most common is people who are allergic to grass pollens. We're talking about 9 out of 10 people in the UK are allergic to grass pollens. So that tend to come on in the kind of mid-May to July kind of time. If you're allergic to tree pollens, which is the second most common, that tend to affect you around March to mid-May. And if you're allergic to weeds pollen, for example, nettles or dock, which is less likely, but it's not rare, the symptoms tend to come on a little bit later in the winter time or autumn time, so sometimes around end of June to September. Now, but be aware that that's not always the case. It's not going to be bang on this period of time I'm going to suffer from symptoms. It all depends on the weather as well. So you can imagine that on a day that is really kind of muggy and really hot, and that at that time you get the highest pollen counts. And on a day that's rainy, it tends to have a slightly lower pollen counts. So management of the hay fever tend to be depends on the symptoms. So some people might say my symptoms are quite predictable. I know when I'm gonna get the symptoms. So you might want to take some antihistamine tablets, or even in a nasal kind of format as and when as per symptoms arise. But sometimes you might want to do a little bit of preemptive treatment, especially on a day that the pollen count is high. And you might say, well, how do I know the pollen count is high? And basically the best way to find out is to watch the news and check the weather. And you know that, let's say that day is going to be really hot and sunny and you're going to be out all day. It's better to kind of like take the medication before you go out to prevent the symptoms come on, rather than you go out and exposed to all these pollens and have symptoms and have a really unpleasant day. So the several formats that you can take. Most common one is the antihistamine tablets that you can buy over the counter, and two main different types. One is a slightly drowsy, more old school type, for example, chloramphetamine, or the branded name would be Piriton, for example. And it's good if you want to have a good night's sleep, but some people may find it a bit more drowsy, and especially if they work long hours or needing to use heavy machinery, that might not be so useful. So that's another type, like for example loratadine, which is a newer drug that causes less sedative effect, and it's a once-day medication. But these are only the two examples that I give. There are loads more antihistamines out there, and antihistamine doesn't have to come into a tablet format as well. It can come in a nasal spray format or even in an eye drops, depends on what symptoms you're actually getting from the hay fever. My personal preference is a nasal spray, but it's a steroid nasal spray. It's just because my symptoms are mainly nasal symptoms without itchy eyes or runny nose, so it's mainly because of the postnasal drips causing me to have a cough. So what I normally do is to use a steroid nasal spray, which you puff up your nose morning and night, depends on which one you're using. And obviously it's not going to be one-off treatment. You need to use it for a period of time to kind of get the steroid to work on the nasal mucosas to bring down the inflammation. And I must say it's very effective, and I quite like using that. One other good things about using a steroid nasal spray is that if you're pregnant, for example, it's generally safer to use when compared to some of the antihistamines, which they haven't actually tested in pregnant women. Although I said that these medication can be bought over the counters, but it's always important to check with the pharmacist and see whether you're okay to take those medication, especially if you're on other medications, for example for your heart or for diabetes, etc., just to be on the safe side. So the bottom line is hay fever is extremely common, and different people suffer different degree of hay fever and present with different symptoms. So the medication that you take for hay fever should be tailored to the kind of symptoms that you're presenting with. And by all means, go and consult your GP if you've got further queries, especially you're on a bunch of medications for other conditions as well, and because you don't want to use medication that you're not sure which might cause complication. And good to kind of do a preemptive treatment, especially on a day that has got high pollen counts. So if you're doing all these tips that I just mentioned, then hopefully your summer will be very, very enjoyable. If you have further questions, please contact your own GPs. And until next time, take care of yourself. Bye bye.